You probably have a bottle of extra virgin olive oil in your kitchen right now that could change how you feel tomorrow morning. Not by eating it, but by using it on very specific areas of your body before bed. I know that sounds unconventional, so stay with me. What I am about to share blends centuries of Mediterranean practice with modern physiology. I will show you exactly where to apply olive oil for the greatest benefit, why this routine is particularly helpful for men over 50, and how to combine it with a few other natural oils to amplify the effect. This is not New Age wishful thinking. This is about supporting circulation, calming everyday inflammatory stress, loosening chronically tight tissues, and yes, enhancing performance in ways that surprise a lot of men. Men in Greece, Italy, and Spain consistently report better sexual function and healthier hormone profiles well into their 70s, compared with many of their peers in the United States. Diet matters, of course, but there is another habit that has been used for generations and largely ignored here: using olive oil externally as part of routine body care. In traditional Mediterranean households, olive oil was not just food. It was rubbed into sore muscles, massaged into the scalp for vitality, and, quietly but commonly, applied around the pelvis to maintain male vigor. These customs persisted because people observed real-world effects and passed them down. Here is the physiology in plain language. Olive oil's lipid profile, rich in oleic acid and squalene, allows it to absorb readily into the outer layers of skin and soft tissue. Once there, it behaves like a gentle local conditioner. It softens fascia and muscle, reduces minor inflammatory irritation from daily life, and, when paired with firm massage, encourages better local blood flow. Its natural tocopherols, including vitamin E, help protect delicate vessel linings from oxidative wear and tear. For many men over 50, where the issue is less about a single switch and more about tight tissue and sluggish microcirculation, this combination is meaningful. Let us talk placement. The first area is your lower abdomen, specifically the rectangle between your navel and the top of your pubic bone. Under that skin run major vessels that feed the pelvis, including branches that ultimately supply erectile tissue. Warm a tablespoon of extra virgin olive oil between your palms. Cold oil on the belly is unpleasant. Using both hands, begin at the navel and make slow, clockwise circles, gradually traveling down to just above the pubic bone. Use firm, comfortable pressure. The feel you would use kneading bread dough. Spend 3 to 5 minutes here. Clockwise is not arbitrary. It follows the natural path of the colon and often stimulates the vagus nerve, which helps settle the nervous system and supports arousal and relaxation. Many men describe a pleasant warmth that spreads across the pelvis as they do this. That is improved blood flow and a nervous system downshift. Area 2 is the inner thighs, from mid-thigh to the crease where the thigh meets the groin. This corridor hosts the femoral artery and important lymph channels that influence pelvic comfort. Years of sitting and stress leave the adductor muscles short and congested, which impairs downstream flow. Take another tablespoon of warm olive oil and work each inner thigh for about 2 minutes. Start at the knee and glide up toward the groin with long, deliberate strokes. The direction matters. You are encouraging venous return and lymphatic drainage back toward the core. Do not be timid about approaching the groin crease. That is where the big conduits live. If you find tender, ropey bands along the inner thigh, that is common. They usually soften over a few sessions as circulation improves. Area 3 is the perineum, the small diamond of tissue between the scrotum and the anus. It can feel awkward to mention, but this is one of the most consequential zones for male health. Beneath this skin lie the roots of the erectile bodies, key blood vessels, sensitive nerves, and connective attachments related to the prostate. Many pelvic health clinicians now use gentle perineal massage to help men with erectile dysfunction and chronic pelvic pain. Warm a teaspoon of olive oil, and with clean hands, make small, slow circles with your fingertips over the perineum for 1 to 2 minutes. No heavy pressure, this tissue is sensitive. You are aiming for a calm, warming awareness, not discomfort. Olive oil's natural antimicrobial and skin conditioning properties help keep the area healthy, while the massage itself encourages blood flow to structures that benefit from it. Men who sit for long periods are often most surprised by how much this helps. Prolonged sitting compresses this area and starves it of movement. Area 4 is the lower back, from the top of the tailbone up about 6 inches. This region is not just about muscles. The lumbar and sacral plexuses that live here carry the nerve signals responsible for arousal, erection, and orgasm. When the tissues overlying these nerves are tight or irritated, signal quality suffers. If you have a partner, ask for help. If not, do your best to reach. Warm 2 tablespoons of olive oil and use firm circular motions for about 5 minutes, paying special attention to tight, tender nodules. The warmth and mechanical work relax paraspinal muscles and the thoracolumbar fascia, potentially easing pressure around those nerve roots. A very common side benefit is less back stiffness and better sleep. The fifth and final area is the soles of your feet, especially the arches and the area just below the ball of the foot. Reflexology language aside, massaging the feet increases overall circulation, reduces stress, and helps shift the body into parasympathetic mode, the state where repair, hormone production, and sexual function are best supported. Before bed, sit comfortably and spend about 3 minutes per foot with a small amount of olive oil, using firm thumb pressure to seek out and soften tender points. Most men find this feels far better than they expect and sets up deeper sleep. If you want to boost the effect of plain olive oil, consider a simple blend I often recommend. Start with 4 ounces of extra virgin olive oil in a dark glass bottle. Add 10 drops of rosemary essential oil to support local circulation. Add 5 drops of peppermint oil for a gentle, cooling, then warming sensation that many men like. Add 5 drops of sandalwood oil, a traditional favorite for male well-being that provides a calming scent and pleasant glide. Combine and shake gently. Essential oils are potent. Do not overdo them. If you have sensitive skin, patch test the blend on your inner forearm first. Another option is to add black seed oil at a 3-to-1 ratio with olive oil. Its thymoquinone content has interesting anti-inflammatory and metabolic properties. Some men also like to mix olive oil 1-to-1 with castor oil on the lower abdomen and low back. Castor oil's viscosity and skin penetration characteristics can make the massage feel more substantive. Here is how to assemble this into an evening routine that takes about 15 to 20 minutes. About an hour before bed, take a warm shower to relax muscles, open pores, and remove surface grime so the oils absorb instead of sitting on the skin. Begin with the lower abdomen, 3 to 5 minutes of clockwise circles with warm oil. Move to the inner thighs, 2 minutes per side with long upward strokes. Then the perineum, 1 to 2 minutes of light, circular contact. If you can reach or have help, spend 5 minutes on the lower back. Finish with the feet, 3 minutes per foot with firm thumb work on the arch and any tender spots. Do not wipe the oil away immediately. Let it absorb for at least 20 minutes. Put on older pajamas or underwear you do not mind getting a little oily. The oils continue doing their work while you sleep. A realistic timeline prevents disappointment. On night 1, most men sleep more deeply. Massage plus the scent and feel of oil are intrinsically calming. You may notice a gentle warmth across the pelvis and low back. During the first week, many men report more frequent or firmer morning erections and steadier daytime energy from better sleep. Weeks 2 to 3 are where the changes tend to consolidate. Erections feel more reliable, sensation improves, simmering aches fade, and overall vitality lifts. By the end of the second month, if you have been consistent 3 to 6 nights per week, the differences are usually obvious. Performance feels more predictable, stamina improves, and you may notice unexpected pluses like reduced low back tightness or fewer urinary irritations. At 6 months, many men describe a quiet but profound shift in how their body feels day to day. That is not magic. It is the cumulative result of improved local circulation, reduced everyday inflammatory stress, and regular downshifting of the nervous system before bed. A few common questions. What if your skin reacts? Start with less oil and shorter sessions and work up. Patch test blends. If you are very sensitive, stick to pure extra virgin olive oil at first. What if you find the process messy? Use less. You want enough glide to massage without dragging the skin, not so much that you drip. A tablespoon per large area is plenty. Worried about stains? Keep one set of older sheets, or lay a towel down on nights you do the full protocol. The benefits outweigh the minor inconvenience. Not seeing changes after a month. Check your consistency and your pressure. You should be working the tissue in a way that feels meaningful but never painful, at least 3 to 4 nights per week. Daily is ideal if you can manage it. Why not just take a supplement instead? Topical application offers advantages you cannot swallow. First, you bypass digestion, which can be an issue in older men. The beneficial lipids reach the skin and underlying tissues directly. Second, the massage is not optional. It is the engine. No capsule can replace the circulation-boosting, tension-releasing effects of your hands. Third, the problems we are addressing, tight fascia, compressed nerves, sluggish local flow, are physical. They respond to physical intervention. Finally, done correctly, there are essentially no side effects beyond slightly oily skin. This is bigger than sexual function. It is 20 minutes of nightly maintenance that most men never give themselves. It keeps tissues supple, supports better sleep, and reminds your nervous system that it can settle. That alone can lower anxiety and lift mood. Many men tell me their partners notice the change first. Not just in bed, but in patience, warmth, and presence. When your body feels better, everything you do reflects it. Here is my challenge to you. For the next 30 days, commit to this olive oil protocol at least 4 nights per week. Get a good extra virgin olive oil. If you are curious, make the simple Vitality blend. Set aside 20 minutes before bed. If the full routine feels like too much at first, do the lower abdomen and inner thighs only. Add the others as you find your rhythm. Keep brief notes on sleep quality, morning erections, daytime energy, back comfort, and mood. Also jot down any unexpected benefits. At the end of 30 days, decide whether it is worth continuing. Most men do not need convincing after that, but I want you to experience it yourself rather than take my word for it. This is not about trying to be 25 again. It is about optimizing what you have now, maintaining function as you age, and feeling vital and confident. Sometimes the simplest solutions are the most effective. If this helps you, share it with another man who could use a gentle, practical way to take better care of himself. Leave a comment if you try the routine. Your experience can help the next man get started. Your body is remarkably responsive to the right care. Often it only needs a little attention and a little olive oil to remind you what it is still capable of.